The GP Forward View is NHS England's plan to stabilise and develop primary care within England.
I think something has to be addressed in general practice as it is. It is unsustainable, and so we need to look at ways of improving staffing and also sort of rationally stopping and thinking what we do that we can maybe share with other people.
The general practice forward view was set up and put forward because there was an understanding that things had to change within general practice, and this was designed to provide a structured process by which that change could be achieved in a way that was supportive and effective to those who are going to be able to take advantage of it. It's been a very positive thing for Park Surgery. It has been a process that has been innovative. I don't know if general practices were prepared for this kind of support, but we found it very useful, particularly the wide range of resources and assets that have been available for us to implement.
Gloucestershire CCG has done something very different to most of the country. They have invested in 7 provider lead GPs. These cover each of the 7 localities within our county, and they are GPs who have been employed to work 3 sessions per month to try and help develop practices and help guide practices and clusters in how to deliver the requirements of the GP Forward View.
Medication reviews, do they need to be done by GPs? The thoughts of clinical pharmacists being able to do those. When, I think the bottom line came when I explained to one of the managers that I ended up doing them on my husband's 50th birthday at 11 o'clock at night.
With the funding in Gloucestershire, we've managed to employ 20 additional pharmacists throughout the county, 2 frailty workers, and we've established a paramedic visiting service for one of the clusters in Cheltenham.
They've been enrolled for about now 18 months, and the GPs are saying we're really adding value both to reducing their workload and actually improving the patient experience in terms of having access to information about their medication, their condition, and how they can actually best look after themselves. I'm hearing time and time again, what did we do without you? Who used to answer these queries?
So medication reviews, and certainly the correspondence management programme, where do GPs need to see every single letter? Do they need to see every single passport photo that's scanned? The answer is definitely not. So let's look at a good way of training staff so they can filter off the unnecessary information that's coming to us so that we can work in a more smart way, really.
The clinical correspondence training was one area where we knew we could be better. The documentary workflow process within the surgery was not efficient, and it was one of these situations where in the back of your mind something's not quite right, but you're not necessarily sure how it can be put right. And so this was an ideal opportunity to get some focused work in putting our processes right.
I've done quite a lot of management training. This actual programme really differed from that because we came away with a plan and ideas from ourselves and other people attending the course for something we could action in practice the next day.
As a team now, we've got some ways forward that we can think about using those tools. I think I put at the end that I feel I've got my management stethoscope finally as part of my training as a GP.
We're really excited about the Productive General Practice programme that we've signed up to, because the good thing about the Productive General Practice programme is that you can actually tailor the training to your own practice and your own needs.
By educating the workforce and the patients, and bringing additional staff into our practices, and by recognising that these staff are better at certain areas than us, will enormously improve the way practices function. They will financially improve our practices, and the patients will get far more what they need for their own health care.
There is still this overarching understanding that improvement is there to be made, and the future means that we will have to not do things differently but do things better in order to achieve the aim of delivering the high quality care that we wish to do.